My name is Amir Kazory and I am from University of Florida. This morning I talked about new aspects of cardiorenal syndrome and new data that has emerged recently and is challenging somehow our conventional understanding of this syndrome. I started by talking about the new hypothesis for development of worsening renal function in patients who are admitted for acute decompensated heart failure. As you know, there has been the hypothesis of low forward flow when we think that low renal perfusion can lead to neurohormonal activation and deterioration in renal function. However, new data point to renal venous congestion as a mechanism for worsening renal function in patients who develop acute cardiorenal syndrome or cardiorenal syndrome type 1. Then I talked about a new subset of patients with acute decompensated heart failure that have been the focus of attention recently, namely those patients who present with improvement in renal function when they come to the hospital and receive treatment for acute decompensated heart failure. This group of patients actually might have different reasons for improvement in their renal function, including relief of congestion as well as somehow recovery phase of worsening renal function, or the reality might be that we see them with improvement in renal function when they are in the recovery phase of their worsening renal function. It seems from the retrospective studies that these patients might actually present with adverse outcomes despite apparent improvement in renal function. I talked about this subset of patients and suggested that if prospective studies confirm the findings of these previous studies, we might want to reconsider the definition of acute cardiorenal syndrome to also include patients with improvement in renal function, or in other words, talk about acute decompensated heart failure plus dynamic renal function as acute cardiorenal syndrome. The reality is this is the 5th time I am in this Congress, and the reason why I have tried to every year attend this Congress is that not only I present my ideas and my findings in this field, I can get very, I would say, thought-provocative ideas from other colleagues that I meet in this Congress. Many of my thoughts actually are coming from discussions that I have had with other faculty members that are attending this conference, as well as just reading their papers, and actually I have started to collaborate with many of those that I meet here.